A teenage mother is a woman who gives birth aged under the age of 20, or more specifically, between the ages of 15 and 19. In 2022, babies born to mothers aged under 20 accounted for 1.6% of all births within Australia. That is 1 in 60 Australian births. The number of teenage mothers giving birth has more than halved since 2011, and the proportion has fallen from 3.2%. Teenage mothers may have experienced family, sexual, and partner violence, family disruption, and socioeconomic disadvantage. Most teenage pregnancies in Australia, as elsewhere, are unintended and around half are terminated. Pregnant teenagers and their children are vulnerable to numerous adversities. However, if these young people receive appropriate healthcare intervention, including non-judgmental medical and psychosocial support, outcomes can be improved for both the young parent and their child. Being a teenage mother has various impacts on the transition to parenthood, both antenatally, postnatally, and sometimes ongoing into the future. Midwives have the opportunity to help these teenage mothers with this transition, lessening the negative impacts and strengthening the positive ones. The transition to motherhood can be negatively or positively impacted by many factors. For teenage mothers, the transition to parenthood is often negatively impacted due to multiple challenges they face. Teenage mothers are commonly faced with judgment from others, formed by the negative social attitudes, beliefs, and behaviours directed towards young mothers, often portraying them as irresponsible, unmotivated, and incompetent parents. This stigmatization has been found to contribute to a reduction in help seeking and confidence, causing isolation and significantly impacting mental health during a woman's transition to parenthood and beyond. The transition to parenthood begins antenatally and is influenced by many factors such as life circumstances of the parents, the social environment, and the circumstances of conception. It is also influenced by the level of support provided by the woman's partner and family, as well as the physical health of the mother and her unborn baby. The mother's experience within her family of origin, her past or current mental health issues, and any current or unresolved conflict, loss, or trauma can also affect and sometimes disrupt this transition. Consequently, it is known that the antenatal period holds potential to provide parents with the opportunity to prepare for the social, emotional changes, challenges, and expectations associated with impending parenthood. It has been found that teenage girls present later to antenatal care and are less likely to have 5 or more antenatal visits than a comparative cohort aged 20 to 24 years old. This has a negative impact on their transition to parenthood, as it minimises the mother's chance of establishing and maintaining new networks and support systems, an essential aspect of transitioning into parenthood. For teenage mothers, the antenatal period presents an increased risk of depression, iron, deficiency anemia, and urinary tract infections compared with adult women. They also have higher rates of hypertensive disorders of pregnancy compared with adult women. These increased health risks can impact her transition to parenthood as they present challenges such as increased stress, difficulties in bonding, and challenges in childcare, affecting both the mother and the infant's well-being.
For mothers under the age of 20, there are a number of increased risk factors surrounding labour and delivery and the health of their baby. Statistically, teenage pregnancies have a higher result of preterm deliveries, babies born with low birth weight, and smaller than average size for their gestational age. Additionally, there is a higher rate of perinatal mortality, neonatal mortality, and stillbirth in teenage mothers, particularly in circumstances of substance abuse during pregnancy and women who face socioeconomic disadvantages. Almost 2 in 5 babies born to mothers under the age of 20 in Australia required active resuscitation, and more than 1 in 5 needed admission to NICU. These factors have ongoing health effects for the child, as well as an impact on the mother's mental health and well-being, obstructing her ability to experience the more positive and fulfilling aspects of early parenthood. The period following labour and birth brings further issues for adolescent mothers, a time in which they face the significant challenge of meeting their own developmental needs and the needs of their child. Postnatal care is vital in ensuring teenage mothers feel supported and confident in caring for their child. Sufficient education and assistance with breastfeeding is one of the key issues related to postnatal care, in which a lack of has resulted in mothers unable or reluctant to breastfeed their child. The transition to parenthood and postnatal period is also linked to mental health issues, in particular postpartum depression, anxiety, and post-traumatic stress disorder, of which adolescent mothers are known to have an elevated risk. Teenage parenthood is a contributing factor to long-term socioeconomic and health challenges for both the mother and child. Compared to women who become mothers in adulthood, teenage mothers tend to have less social support, lower educational levels, fewer job opportunities, and poorer mental health. In turn, children of teenage mothers may go on to reveal behavioral, emotional, and cognitive disadvantages. They are at a higher risk of being removed into the care system and are more likely to become young parents themselves.
Midwives support young mothers by providing personalized medical care and closely monitoring risks such as premature labor, stillbirth, and low birth weight, complications that are more prevalent in teenage pregnancies. Given the heightened physical risk and increased likelihood of complications, pregnancy can be particularly demanding for teenage mothers. This underscores the importance of midwives to provide tailored care to address these challenges, ensuring timely interventions by doing regular checkups and offering continuous support to safeguard the health and well-being of both mother and baby throughout pregnancy. At the same time, midwives play a vital role in addressing the emotional challenges faced by teenage mothers. Young mothers often experience feelings of shame, isolation, and fear of judgment due to societal pressures, which can create significant barriers to seeking help. Midwives actively counter these issues by creating a non-judgmental, compassionate, and understanding space where teenage mothers feel safe and supported. By treating each teenage mother as an individual, free from assumption and focusing on her unique needs, midwives build trust and respect. This approach not only helps teenage mothers feel more comfortable, but also encourages them to seek the care and support they need. Furthermore, midwives play an important role in empowering young mothers by ensuring they fully understand their healthcare options, from developing birth plans to choosing feeding methods. Midwives also acknowledge that feelings of uncertainty are natural in teenage pregnancy. They address these fears by educating young mothers on the childbirth process, pain relief options, and what to expect during labor. Midwives provide clear and accessible information that empowers teenage mothers to make informed decisions, boosting their confidence. This guidance helps them normalize their emotions, gain a sense of control, and approach childbirth with increased trust in their abilities.
The continuity of care model is particularly beneficial for teenage mothers, providing them with consistent support throughout pregnancy, birth, and the postnatal period. Midwives play a crucial role in helping young mothers navigate the challenges of early parenthood by building trusting relationships and offering personalized care. One of the major concerns for teenage mothers is the higher risk of rapid repeat pregnancies within 2 years of giving birth. Research indicates that 30% of teenage mothers become pregnant again within a year, and 25 to 50% experience a repeat pregnancy within 2 years. To address this, midwives can suggest immediate postpartum contraceptive counseling and provide access to long-acting reversible contraception, ensuring young mothers make informed choices about family planning. Regular postnatal home visits from midwives can further enhance contraception outcomes by ensuring that teenage mothers receive the necessary guidance and support in a familiar environment. In addition to contraception, teenage mothers often struggle with breastfeeding, but may hesitate to seek help due to lack of confidence or fear of judgment. The continuity of care model allows midwives to establish strong ongoing relationships with young mothers, providing proactive lactation support and encouragement. Furthermore, postpartum depression is a significant issue among teenage mothers, with prevalence rates ranging from 16% to 44%. Ultimately, this can impact maternal-infant bonding and overall parenting confidence. An ongoing supportive relationship with a midwife is crucial to identify early signs of emotional distress and provide essential mental health support. By fostering stability, trust, and empowerment, midwives using the continuity of care model plays a vital role in helping teenage mothers transition into parenthood with greater confidence, improved health outcomes, and long-term well-being.